That's something that can be very helpful for the survival of our species, to not have a bunch of babies when there's a war, famine. Things like watching scary shows, watching the news, or as some people call it, fear porn, right? Like when you're constantly tuned into that, what is your subconscious telling you?
And so what is your dose?
1/4 of the higher dose one of the...
So the Tro Plus, yeah. I have a funny story when I was in medical school and we were learning about the jaw in anatomy class. And I ended up getting punched in the face randomly on the street, right in my jaw.
How was that?
Like, well,
what kind of places were you in?
I was in Baltimore. Right? Anything's possible in Baltimore. Welcome back to the Smarter Not Harder podcast, your home for 1 cent solutions to $64,000 questions. I'm your host again today. My name is Dr. Scott Sherr, and it's a pleasure to be back with all of you. This was a fantastic episode to record with Dr. Izabella Wentz. Here is a bio on Izabella. She is a compassionate, innovative, solution-focused, integrative pharmacist dedicated to finding the root causes of chronic health conditions. Her passion stems from her own diagnosis with Hashimoto's in 2009, following a decade of debilitating symptoms. She's an accomplished author, written several best-selling books, including the New York Times bestseller, Hashimoto's Thyroiditis, Lifestyle Interventions for Finding and Treating the Root Cause, the protocol-based #1 New York Times bestseller, Hashimoto's Throat Protocol, a 90-day plan for reversing thyroid symptoms and getting your life back, and the Wall Street Journal bestseller, Hashimoto's Food Pharmacology, Nutrition Protocols and Healing Recipes to Take Charge of Your Thyroid Health. Her latest book, Adrenal Transformation Protocol, was released in April 2023. This book focuses on resetting the body's stress response through targeted safety signals and features a 4-week program that has already helped over 3,000 individuals. This podcast was so much fun to record for me. Izabella is just a fantastic human, and she has a lot of great in-depth knowledge, of course, about the thyroid and thyroid health. And she even was gracious enough to answer a couple personal questions regarding my kids as well. So we started off speaking about the evolutionary understanding of hypothyroidism and how this is manifesting in modern day craziness, the stress of life and the stress response and not feeling safe in so many different ways. We then discussed thyroid nutrient deficiencies. We spoke about selenium. We talked about thiamine, magnesium, vitamin D, B12. And we had a great conversation about ferritin as well, and how this is such a huge issue for so many thyroid patients. We then transitioned over to talk about various types of things like toxins in the environment that are affecting thyroid care or thyroid function, infections like H. pylori, Blastocyst hominis, and how that's also potentially correlated with Hashimoto's. We then discussed multiple different rabbit holes that Isabella is going in recently and understanding how you can reverse food sensitivities in multiple people, dairy sensitivities, egg sensitivities, and others. And we finished off the podcast talking about how Isabella used Methylene Blue, Just Blue, and Tro Plus Blue from Transcriptions in writing her latest book, which is going to be coming out in the next couple of years on IBS. Again, this is a fantastic conversation. So much fun for me to record. We went on much longer than I anticipated with Isabella, who was gracious with her time, and I really do appreciate it. If you like this podcast, don't forget to like and subscribe below so you never miss an episode. Please share with your friends and enjoy. Isabella, it's nice to see you.
Hey, Scott. Thanks so much for having me. It's so great to see you again.
Well, I'm just so excited to have you, Isabella. I've been watching and reading about your work for so many years. You've been doing podcasts and media related to your work in Hashimoto's and adrenal fatigue. And I know you have new books that you're working on as well, and some interesting work individually, personally with Methylene Blue that I'm excited to get to talk about as well with you. You've done a lot of these podcasts, and I'm excited for this one because we get to go the practitioner route. We get to get into the weeds if we get there, and we find different ways to get there. And the way I wanted to start it today is one of the things that I'm very interested in, and I was mentioning this to you before we started the podcast, is kind of the evolutionary history as to why we would have this happen to our thyroid, for example. So why would we have even a state of hypothyroidism as something that could be an advantage, not only a disadvantage as we think about it today?
An interesting body of work. So I've spent years and years and hours studying Hashimoto's and why does it develop? Are there toxins involved? Why do we have higher rates of it now? Is it the female gender? Is it pregnancy? What's really going on and what really causes people to develop Hashimoto's? And after about 5 years, I happened to attend this presentation, and a woman was talking about how during the Irish potato famine, the people that became hypothyroid were more likely to survive. And then it got me to start thinking about, how does hypothyroidism, from an adaptive physiology standpoint, how does it help us survive and how does it help us adapt? Because when we look at like the body and what it does and why certain illnesses occur, from an adaptive physiology standpoint, it's to adapt to our environment, right? So when somebody is very toxic, they might be holding on to more weight because they can dissolve the toxins that are fat soluble and in the extra fat that they have on their bodies. And that's one of the theories behind obesity as a protective mechanism, right?
Right, sure.
And so with thyroid disorders, one of the things that I thought about was, what are some of those symptoms that we have when we're hypothyroid? And of course, we're losing hair, we're gaining weight, we're less fertile. And when can some of these things be helpful? And of course, we're tired and brain fogged and not as likely to go out into the world. And of course, things come to mind, famine, right? So when you're in a famine, wouldn't it be helpful for you not to need as much food? Would it be helpful for you to have this amazing metabolism that you need to eat like 300 calories a day? Otherwise you will wither? Probably not. But wouldn't it be amazing to have this hypothyroidism sort of semi-hibernation state when you're in a famine? Looking at some of the thyroid parameters in hibernating bears, right? There's a bit of more reverse T3 and different types of changes that occur with hibernating bears that allows them to slow down their metabolism and allows them to essentially not leave their caves. So another situation where we wouldn't want to leave our caves back in the cavewoman days would be if we were going through a war or there was some kind of a tragedy in the world. It would be much better to stay safe inside of our caves. And hypothyroidism also causes like libido issues. So you're not in the mood and you're also losing hair. You've got this skin. So probably you're not as likely to attract others, right? If you're one, in a bad mood, and two, not really out there in the world. And that can be very protective in terms of fertility, right? Women tend to have more cases of hypothyroidism. Our bodies are tuned in and sensing our environment and trying to figure out, is this a safe time to reproduce? Because you've got 4 kids, I've got 1, but we know that it takes a toll on not just the woman, but as the family, the species as a whole. So it will be better.
Mostly women, but anyway, okay, yeah.
Of course, but like the men supporting them too. So that's something that can be very helpful for the survival of our species, to not have a bunch of babies when there's a war, famine, or something else going on in the world. And so I really started to think about that. And then it's safety, right? And the cell danger response, and our body's always sensing what's going on in the world. And there are a lot of things, I think, in our modern world that lead us to essentially send those same signals of, hey, there's a war, hey, there's a famine, hey, there's something going on in the world and we're not safe. And I call this the safety theory. And I think about a lot of the women that I've worked with, and one way they can send these danger signals to their bodies is over-exercising, right?
Sure.
Overworking, psychological stress and trauma. This can send us a message that we're not safe. Things like watching scary shows, watching the news, or as some people call it, fear porn, right? Like when you're constantly tuned into that, what is your subconscious telling you? I know it's like, this is happening very far away, but your cave woman brain just doesn't know that. Right. So you get these messages sent to your subconscious that tell you that it's not safe. Other things are eating foods, inflammatory foods. When I think about cave women, when would they eat like something in a box, right? Like when would they see a box and decide that they wanted to eat it? So that probably when there was like a lack of food around or something that was causing inflammation in their body. And these are just some of the factors that lead us to essentially shift our body into this like danger zone where the body's like, girl, I'm going to help you out. Seems like you're running on a treadmill. There must be like lots of bears here. You're eating very few calorie things and you're eating the stuff that isn't really food. I'm going to help you out, girlfriend. And I'm going to let you hold on to all of that extra weight, right? Because clearly you're not safe. When we need to conserve energy I'll give you all this fat to protect you. So that's sort of the the idea that I came across. And sure enough, I've tested this theory, this safety theory with clients and people in my group programs. And when we really focus on those messages of safety and try to minimize those danger signals, they get better, and they get better in like 3 to 4 weeks, where a lot of their symptoms that they've had for 10, 15 years, 20 years, they just begin to like shift and melt away. And all of a sudden they're not anxious, their weight is coming off, they're sleeping better. So this is my whole safety theory in a nutshell.
I love it. And it makes so much sense, right? Because when you have stress on the system is going to react in a way to try to protect you. And that's going to be not only your thyroid, but it's going to be multiple different locations in your body that are all kind of simultaneously happening. But I would imagine as one of the primary regulatory, or if not the primary regulatory hormone or the hormone producer of our body, aside from our brain, of course, it would be the thyroid that does most of this.
Absolutely. So our thyroid manages our metabolism, as we all know. And when we're very stressed out, I think a lot of us realize our body starts to adapt. So we might have more cortisol production in the early stages, and that can go down with time.
Right.
And that also impacts thyroid function. So, there are times when people will have quote unquote absolutely normal thyroid function, but they have all the thyroid symptoms, and we'll look at an advanced thyroid panel and they'll have high levels of reverse T3. And this is a molecule that likes to sit on thyroid T3 receptors, but it just blocks them. Oftentimes this is high stress, or this could also be low ferritin levels. These are some of the drivers of something is off in the body. Let's slow things down. Let's figure things out.
Yeah. Well, I just want to go back initially. You talked about bears. So I want to ask about, you mentioned bears and reverse T3 and slowing down their metabolism. Do you know anything about this in particular, or is it, we just know that they have mechanisms for hibernation that allow their thyroid to slow down for long periods of time so they don't have to move, kind of deal?
They do. Yeah. They have their thyroid glands adapt to the cold, and they've done some studies on this, but essentially their thyroid function gets altered during wintertime, and they're not out there hunting and gathering food. They're just able to like chill in their caves and have all this wonderful fat, right?
Yes.
And sleep. And it's like that to me is kind of like, I wonder what would happen if people became hypothyroid in the winter. Would that happen if we didn't have all of these interventions, right? Not that I'm recommending this as an experiment. I don't think we have the same adaptations as bears do, but they've adapted over many, many years.
Right. We all have the base physiology that's very likely similar, and it's just been sort of out of that family tree adapted to being a bear as opposed to a human. But that hypothyroid physiology that happens during stress, I love the idea of the safety theory in general. We don't think about it in the context of somebody that's very, very, very active and exercising all the time. They lose their menstrual period, for example, right? That's also another adaptation, because when you're stressed all the time, that's also going to be affecting thyroid function, affecting hypothalamic function as well, as far as hormone release. So everything's interconnected in here. And I think when you talked about famine, what it made me think of is there are some pretty common nutrient deficiencies overall that can induce a hypothyroid state or a thyroid deficient state. Do you want to speak to that a little bit, as far as what are the most common ones that we see, and also some of the main toxins that we see that are also at this point affecting thyroid function?
I love focusing on nutrients, as nutrient deficiencies are something that's really easy to correct for most people. And that's oftentimes the first place I start with people, as well as the nutritional component, getting off of inflammatory foods. I would say selenium is probably the biggest one and the first one that I would think about with somebody that has autoimmune hypothyroidism. We know that Hashimoto's is the primary cause of most cases of hypothyroidism in the modern world. So I'm going to speak to everybody about that. And from that perspective, selenium deficiency has been known to be an environmental trigger for Hashimoto's, and replenishing selenium levels can help people significantly. Generally 83 micrograms to 200 micrograms per day has helped people with things like anxiety and hair loss. And a lot of times within about 3 months, you'll see that their thyroid antibodies can go down by 40 to 50%. This is one that I really advocate for a lot of people. The other one is myo-inositol. So this is something that has just come through the research in the last few years, when I first was on my healing journey and I was first working with people, this wasn't really on my radar. But in the last, I would say 7 years or so, the focus has been on utilizing myo-inositol. The studied dose was about 600 milligrams combined with selenium at 83 micrograms. And the two of them have this synergistic effect where a person will be able to potentially, like subclinical hypothyroid patients can be corrected to normal thyroid function with just these two nutrients. And also thyroid antibodies can go into the remission range. So there's this amazing synergistic effect. And the thought process is it has something to do with, the blood sugar regulation, blood sugar optimization. But I think there's other mechanisms at play with it that are not yet quite described. The other nutrients that I think are very relevant would be thiamine. I have found for people who have this thyroid fatigue, they have low blood pressure, they have a lot of brain fog, potentially some anxiety, and some of those orthostatic hypotension POTS individuals, utilizing that can help them recover from their fatigue in just like 3 days, 3 to 5 days. So whenever I see somebody with that, I would recommend something like benfotiamine, 600 milligrams, just for like a trial of, get one bottle of that and see how you do. And I have had so many people who were like, there were people on disability that were working again, or people who were like bedridden that were able to move around. I will get random hugs from strangers at conferences because they'll say, you changed my life because I read an article of yours and you happened to mention benfotiamine, and it was just a few days and I got better. This is another one that I feel like is very much not talked about, but very important. Magnesium deficiency. I mean, who isn't magnesium deficient, right? But this really helps a lot of people with hypothyroidism. There are studies that have shown on ultrasound, the thyroid gland can normalize with magnesium citrate. It won't happen within days, but it would be like 5 years of using that on a regular basis.
Citrate. Interesting. Okay.
Citrate. And I tend to use that because a lot of people are constipated.
Right. Yeah.
I know glycinate is much more cool and trendy, but for me,
chelate and all the other ones, come on.
Yeah. There's all these other fun ones, but for people that I work with, I typically start them on the citrate because a lot of their symptoms just really improve and vanish.
Makes sense.
Vitamin D. I mean, if you have an autoimmune condition, this is a big game changer.
Sure.
A lot of my ladies who are in remission, I will aim to get their vitamin D levels about 60 to 80.
Yeah, me too.
And this is something that is very simple. And typically when people have like seasonal depression, I mean, I just test everybody for that. If I'm going to be working with them, that's kind of the basic panel. And then we're looking at B12. So some people do have pernicious anemia with Hashimoto's. I know I'm going on a tangent. I'm just like trying to give you the useful pearls. But pernicious anemia is often caused by H. pylori, which is also a trigger for Hashimoto's. So whenever I have a person with low B12 levels and elevated thyroid antibodies, I'm thinking, and acid reflux and food sensitivities, I'm thinking H. pylori. And when you treat that accordingly, that can get rid of the pernicious anemia, that can get rid of significantly reduce Hashimoto's antibodies. Sometimes people can lower their dosage of medications or even come off. And so B12, I generally test for, and I prefer to use like a sublingual version of it. I think injections are great too, of course, but I typically find some people love to give themselves injections. A lot of people don't.
Yeah, sublingual because it's easier to absorb here as opposed to if they have a digestive issues. Is that why sublingual typically?
So definitely because of digestive issues and because of, the anti-parietal cell antibodies against intrinsic factor. So people or intrinsic factor producing cells. So people who have Hashimoto's generally are more likely to have other autoimmune conditions such as autoimmune pernicious anemia. So this is just always something that's in the back of my mind. And they also might have low stomach acid, or they might have SIBO, or other reasons why they're just not absorbing the B12 orally, so that sublingual works really, really well. And I have a nice little protocol where we'll use like 5,000 and over the course of a time period, and then we kind of give them a maintenance dose. But that tends to replenish their levels pretty well.
5,000 micrograms of B12? I mean, okay.
And then the other thing that is really relevant for a lot of people, and I've been talking to practitioners just here and there, I'll have casual conversations. I was shocked that not many people are doing this or testing for it, but ferritin, the iron storage protein, this is something that's going to be low in a large population of people with Hashimoto's and hypothyroidism. And this is one of the primary reasons why somebody is on like a levothyroxine or Synthroid or a T4 containing medication and they're not feeling well. It's because we need that for proper T4 to T3 conversion and for proper shuttling of thyroid hormones into the cells. Typically, I'll see people with low ferritin if they're on a T4 only med. They'll have hair loss and brain fog and weight gain. And you can do one of two things. You can switch them to like an Armour or natural desiccated thyroid, and that will kind of bypass that ferritin system. Or you can just give them you could just give them more, iron in a form that they can absorb, and that will correct it, and they will do fine on T4, with the exception of some people that might have other things going on. So oftentimes it's like, what do you do to get a person feeling better? Oftentimes it is doing like a T4, T3 combination and addressing their ferritin. But I will say some practitioners in the integrative world, they'll just be like, oh, you need Armour, and the low ferritin isn't on their radar. And that's such a big needle mover for people. And I know personally for me, I was like, oh, holy cow, like you can have restless leg, you can have a shortness of breath, you can have hair loss, you can have depression, anxiety, trouble sleeping at night, and, pale skin and all of these things.
Strange food cravings, I think too, right? So you get strange food cravings.
Yeah. I've had clients who are like just eating carrots nonstop. And I'm like, I don't quite understand that mechanism. But of course, pica is a red flag for that, right? Yeah.
Pica is the classic way we think about iron deficiency, and ferritin being low is correlated to typically like an iron deficient panel kind of deal. I have a lot of questions for you, but I want to make sure you get through your whole list. This is great. Maybe I'll stop you for a moment here. Just a couple of things to point out. You had the option, you're going to be testing people for these things, right? Selenium, thiamine levels, magnesium, vitamin D. I know that not everybody can do that right away. And these are relatively safe things to start off with. But something like selenium, for example, you could get people taking too much of it over time because it does have some antioxidant capacity, but also has the ability to be the opposite, right? So if you're thinking about these selenium, thiamine, magnesium, vitamin D, B12, and ferritin, are you typically testing this in most of your clients or recommending it?
So I definitely recommend testing B12. I definitely recommend testing ferritin and vitamin D. So generally with ferritin and vitamin D, we can overdose. Iron overload is potentially worse than iron deficiency, right? Sure. And of course, with B12, we want to know that you're actually absorbing it. Rather, having really low levels leads us to think about what else might be going on. These three are a deal breaker. Like you definitely have to test for them. With thiamine and magnesium and myo-inositol and selenium, some of these other nutrients, I might just start somebody on a trial of them and see how they do. The selenium, the caveat with that, it is a narrow therapeutic index nutrient. So doses under 100 when used by itself may not be effective. And doses above 600 might be toxic. And so there's also like an optimal time period where you would take it maybe 3 to 6 months to replenish your stores rather than taking it for 10 years.
Got it.
I have seen people with a lot of times the CBS gene mutation where they just have sulfur intolerance, where they end up becoming toxic from excess selenium. These days, I really like using it with, back in the day, I used to recommend 200 to 400 micrograms for most people. These days, I really like using the 83 micrograms with the myo-inositol because it's a lower dosage, so you're less likely to become toxic, and there's a synergistic effect. And one thing, I know everybody's like, Brazil nuts. Can I just tell you, please, like, if you like them, please eat them. But I've done the labs for people and they're eating 2 Brazil nuts a day. Amazing. They're great for you. They're beautiful whole foods, but they're not going to move the needle like a supplement will,
No, not typically. That's been my experience.
Sorry.
That's been my experience too.
Yeah. I love food as medicine. Don't get me wrong, but it's just one of those pet peeves where people, I'm like, doesn't actually work.
I
like
know.
rubbing olive oil over your thyroid gland, rubbing coconut oil over your thyroid gland. These things, like, amazing. They'll make your neck smooth, but they're not actually going to work, right?
That's a thing, huh? Rubbing coconut oil on your thyroid?
Yeah, that was one of the things I think when I was earlier on my healing journey, it was like I tried all these things. And that was one of them. Did not work, right? Made my skin really soft, amazing. But yeah, there's a lot of things that sound good in theory, but they just don't really work in practice.
Yeah, of
So
course.
I'm excited to share about those.
Yeah, and as clinicians, like, you don't know sometimes, right? Because when you're living outside the box of conventional medicine and you're doing things that are trying to help people, sometimes you're going to miss. But coconut oil on the thyroid is not, it's pretty benign overall. So that's pretty good, right?
Oh,
if
absolutely.
a patient came to me and said, hey, I want to put coconut oil on my neck to help my thyroid, I'm like, well, there's no evidence, but go for it, right? Doesn't sound like it's going to hurt anything, right? So
it'll make your skin beautiful. Go for it. Yeah.
Yeah. And shiny, great. Before we got on, actually, you were telling me about this series on ferritin that you just did on social media. And I thought, given we're talking about it now, it would be a great time to discuss it, because I've had conversations with functional practitioners as well that specialize in the thyroid. And it's not something that I've heard of very much, in the sense of most people as in this community will actually just change people over from Synthroid to Armor, just kind of hands down, right? In the sense that you're just getting T4, you're getting no active T3. You shouldn't be doing that. Most people have a hard time converting from T4 to T3. You're not going to feel as good as if you were taking some active T3 as well. And that's kind of how I train to some degree as well, at least on the hormonal optimization side of things, where it is difficult as we get older, at least I think, to convert from T4 to T3. So maybe you can talk about that a little bit, the conversion, and then how ferritin, you already kind of mentioned this, but I know maybe you can go into maybe some more detail about the ferritin aspects and what that means overall.
Yeah, so absolutely. And I think yes to both. So a lot of times with thyroid, there's a lot with Hashimoto's, there's like the root causes. Why did you develop it in the first place? There are the consequences of being hypothyroid for a long time. And then there's the actual hypothyroidism itself. So there's like a few different things going on when a person has Hashimoto's. And a lot of times to bring a person to going from like, sloth-like or bear-like to like a thriving person, you have to address all three of these things. And I feel like hypothyroidism, we can get really focused on that. And then oftentimes it is doing that T4, T3 combination. Not everybody, but for some people that is absolutely the answer. But we also have to look at the other things. So what are like the root causes and what are the consequences of being hypothyroid? One of the consequences of being hypothyroid is going to be low stomach acid. And some of the root causes that lead to hypothyroidism, such as H. pylori infections, can also lead a person to have low stomach acid. Right. And what does stomach acid help with absorbing, right? Iron. Other things, right? It helps us with absorbing our nutrients from food. And a lot of times you can have people who are going to have low levels of ferritin because they are deficient in stomach acid. And sometimes it's correcting their stomach acid if they're eating like a rich diet in iron that will help them get more ferritin on board. Sometimes it's telling people, okay, you're eating a vegan diet. You're probably going to be deficient in this unless we change your diet or give you a supplement, right? I think most people with that think about anemia. You think about like overt anemia and you think about low hemoglobin, hematocrit, and you do your iron panel, but a lot of people don't test for ferritin on that iron panel. And that's going to be like an early indicator of iron deficiency. And again, this is something that's very commonly low in people with hypothyroidism. Hair loss is one of the red flags for this. Okay. And for proper hair growth, we need it to be at least 70 to stop shedding. And then like 90 to 110 is about where we want it for optimal thyroid function, because we need it to carry our thyroid hormones to the cells and all those good things for proper T4 to T3 conversion. Right. But the other reasons why people might be low in ferritin, we think about it's like a supply and demand. So if you are a woman with heavy menses, so this could be because you were hypothyroid for a time period, you could be losing a lot of blood in your menstrual cycle. And then because you're already anemic, there's like this vicious cycle where if you're anemic, you're going to have heavy periods, which are then going to cause you to be more anemic. Right. And so even being hypothyroid for a short time period, which will cause heavy periods, can kind of lead to that effect. or having low levels of progesterone, or myo-inositol can also be very helpful with that, or having methylation deficiencies in like the methylation cofactors. Sometimes women will have very heavy clots in their menstrual cycles because they need more methylfolate, right? And these are some of the things that you would want to correct. You could have low levels of ferritin because you have some unwanted visitors. So this could be something like Giardia. It could be some kind of pathogens or SIBO that are taking whatever iron that you're eating and they're making biofilms with it, right? Instead of letting you have your iron, they're keeping it for themselves. So these are some of the things. There's also deficiencies in cofactors. Our kidneys produce our EPO. It won't show up on like kidney tests if you just do traditional CBC, CMP, but people who have like ochratoxin level elevations on their mycotoxins results, oftentimes we know that ochratoxin is nephrotoxic, right? And these people might have really low levels of ferritin. And I think it has something to do with EPO. So sometimes it's using actually traditional Chinese medicine herbs to help address that kidney production of EPO. So a lot of times it's looking at what exactly is going on with this person and how to properly get their iron levels up. The thing that I oftentimes see, it's like, okay, you've got low ferritin, just eat more red meat. And that works sometimes. And then you have, okay, just take an iron supplement. And sometimes that works. Sometimes that makes people more constipated and doesn't really improve their levels. Other things that can be helpful for people with like gut issues would be lactoferrin. It helps to break up the biofilms, and it also helps to bind the iron so it comes to us rather than the pathogens. And then iron infusions are a way to kind of bypass that gut system. That was a lot of information.
That's good. I love it. For me, I've always been more interested in high ferritins because I see that oftentimes because ferritin is what we call an acute phase reactant. So as a result of that, if you have systemic inflammation, what can often happen is you can get this sort of anemia of chronic disease. And anemia of chronic disease means you have normal stores of iron, but you can't utilize them in various ways. You can't transfer the iron. That's something called transferrin. The ferritin is sort of the storage form of iron as well. So is it difficult sometimes with people? Like I could imagine if you have an autoimmune condition, you have systemic inflammation, is it more difficult to know? Because like ferritin can be elevated in some people maybe spuriously, but maybe it actually is quite low and it's just an acute phase reacted in that capacity. Does that get complicated there a little bit?
Like just in my experience looking at the lab results of everybody that I've tested over many, many years, majority of the people I've worked with are women. So I would say like 90% of the time it's women reaching out to me and I'm working with them. A majority of them have had low levels of ferritin. They're menstruating or they're losing a lot of blood with childbirth. Women have this capacity to manage their iron stores. With men, I have seen more often, and women, postmenopausal women, where they have the elevated ferritin.
Okay, interesting.
And I don't have a ton of experience with that, other than, we talked about this with my husband, who actually had elevated ferritin when we were living in Boulder. And he just did his ferritin labs, and I think he hasn't done an iron infusion since, infusion.
A phlebotomy.
He doesn't do infusions. He does the opposite, right?
Yeah.
He used to do blood donations or therapeutic phlebotomies.
You have leeches at the house yet, by the way? I think you could just get some leeches,
Yeah, that would be really helpful. I was just put him on me to spit it out. Give me the rest. We used to have to do those every 3 months. I think his ferritin levels were like 400, 500, maybe 600 when he was initially diagnosed when we were living in Boulder, and he had a ton of symptoms of toxicity where we found that a lot of his symptoms sort of vanished when we went on a 2-week vacation to sea level, and we were like, oh, maybe you're just more relaxed. What's happening? My mom's found some random article about high altitude driving EPO production. Yeah. And then we tested him for hemochromatosis genes, which he didn't have the first 3, but he had type 4 hemochromatosis. We did Bob Miller's genetic test, and he had a ferroportin gene variation where most people kind of manage their iron levels at elevation, but with the ferroportin gene defect, he wasn't exporting it correctly. Had his last therapeutic phlebotomy, I want to say end of 2020, and we just his ferritin levels have been like normal ever since. I think they were like, we just did them recently and they were like 134.
Amazing. Yeah.
Yeah.
Pardon the interruption. This episode is brought to you by Transcriptions, makers of precision-dosed, pharmaceutical-grade, and physician-formulated formulas in the form of a buccal troche. Check out our Methylene Blue products here. Just Blue, Blue Carnitine, even Tro Plus Blue if you're a practitioner. Isabella is a huge fan of Methylene Blue. She talks about it in detail in this podcast. It helps her with energy. It helps her with focus, helps her with inflammation, and it can help you too. Go to transcriptions.com and save 10% on your order by using code POD10 at checkout. Now back to the show.
And
I mean, I would have been an
400.
advocate for you guys to stay in Colorado because you would have been my neighbor and you would have just gotten them some leeches and, not a big deal. So, but I can understand, it sounds like being back at sea level is a good idea for him, but
we'll come and visit. We do love Colorado and we miss it, of course, but it's just amazing how various genes can express themselves because this has never been an issue for him.
Right.
At sea level. And then all of a sudden we were living at elevation. And so that was sort of expressing itself and that was an issue for him. And now I always wonder when I talk to people from Colorado, I'm like, you've got high ferritin levels. That's interesting. Tell me more, right?
Right. That's what I think there's a bias. It's called the recency bias. Right? Doctors are very subject to this. When we see somebody that has a certain condition and it's something weird, usually, then we think that everybody around that person, all of our other clients, do they have that too? They may have that kind of weird zebra at the same time. So
yeah, I get very suspicious of everybody that has high ferritin. That's like the first question I would ask is, I would be like, where do you live? Right. But definitely there's a lot of drivers to that, such as inflammation in general.
Yeah. I mean, the expression of genes is such an interesting world too, right? But this is a genetic abnormality, right? But it's still, people think that there's like sort of like a zero-sum game here. If you have a genetic thing, it's going to express 100%. Or if you don't have a genetic thing, you don't have any problems, right? But then there's genetic expression of these kinds of things. And there's also the epigenetic expression related to the regulation of these genes as well. So there's like so many different factors, but not to go down that rabbit hole for now. I want to go. So I wanted to go and talk about the one major nutrient that everybody cares about that I know you have some significant thoughts about, which is iodine, and how iodine plays a role as far as deficiency, toxicity, optimal levels. What are your thoughts here? Because I know you've spoken about iodized salt, for example, and how that may not be a good thing, and other kinds of ideas around that.
It's a very controversial nutrient, and like our little thyroid community, there's like the pro-iodine and the anti-iodine camp, and we fight with each other every now and then, but mostly we just appreciate each other and the work that we all do in advocating for people. So when I first started with my own health journey, I kind of wondered, do you need high iodine? Iodine obviously makes up thyroid hormones, so it would seem logical that if you had low levels of thyroid hormones, you would need more iodine. And of course, this is the truth in the case. In hypothyroidism, that is non-autoimmune in origin. So countries that do not add iodine to the salt supply, that don't have an iodization program, they do have higher levels of hypothyroidism. And researchers, public health officials, always looking out for us. They're like, people are becoming hypothyroid because they're low in iodine. Mm-hmm. Let's give everybody iodine in their salt. Like, this is going to be amazing. Nobody's going to have hypothyroidism. And wishful thinking, I would hope that would be the case. But unfortunately, we've got these individuals with genetic predispositions that when they have too much iodine, they're going to develop autoimmune hypothyroidism. And they did some studies in like Iran and parts of Eastern Europe where they had people before, the rates of Hashimoto's before iodization and the rates after. And oftentimes within 5 to 10 years, they were double, triple, sometimes quadruple.
Wow.
When they started adding iodine to the salt supply. And again, it's one of those nuances where you can't tell everybody to do the same exact thing because we're all individuals. So people that are genetically susceptible to Hashimoto's hypothyroidism, autoimmune hypothyroidism, they're going to have a harder time with iodine excess. What is iodine excess? Anything above like 300 micrograms per day, anything above 350 micrograms. The amount that's in a multivitamin prenatal, generally fine for most people, even with Hashimoto's, even when they're taking thyroid medications. Taking that will actually help thyroid function, potentially reduce their autoimmunity, but you've got to keep it in balance because the dose determines whether something is a toxin or a remedy, and doses above that can become toxic. I know there's some practitioners that use milligram doses, and I've had, unfortunately, many clients that have come to me and they were like, my TSH was like at a 5 and I had some thyroid antibodies and I wasn't feeling great. And so I saw somebody, they gave me high dose iodine and they're like, next thing I know, I was bedridden. My antibodies went to 2000 and my TSH is at like 100. And what do you do? And for those people, I would put them on a lower iodine kind of plan for a few months, under 100 micrograms. And then what we focus on, liver, adrenals, gut, nutrient sufficiency, trying to figure out what chronic infections are driving your autoimmune response. Because in my experience, a lot of times it's chronic infections for people that don't get better with the gluten-free diet or basic nutrition.
Sure.
And then their thyroid antibodies would come down and they'd start feeling human again. And that TSH would get normalized or back to 5 or maybe to 4. There are some studies that show that iodine restriction can normalize hypothyroidism in subclinical cases. I will say the studies were very convincing. I haven't seen that clinically as much as I would like to, where I've maybe had a percentage of people where I'm like, okay, this has actually worked well for you. So my take this time is not like ultra low iodine, and it's also not like high dose iodine. The amount that's in a prenatal or a multivitamin is probably going to be the best fit for you. But seaweed snacks, all of that extra intake of iodine, that can be toxic for some people. I've had clients with like new onset Hashimoto's because they were eating like seaweed snacks or a bunch of things like that. Where
there's not that many sources. I'm sorry, Trevor. There's not that many sources of iodine in the diet now, though, as well. Have you found any good ways to test? Because as far as I know, there really aren't that many great ways to test for iodine as well, right?
I've gone down the rabbit hole of that and I've come back with nothing. You could do the patch test. I'm like, does that really work? And you could do like a urine test, but it's great for population testing, but it reflects your iodine intake in the last 24 hours. I feel like there isn't as great of a test for it. If you are human, you should run because running is good for you. But if you have a broken leg, you probably shouldn't run, right? If you have adrenal fatigue, running's going to make you worse. And it's all those nuances where I kind of get annoyed with this advice that everybody should do. Just because you have a thyroid, you should take iodine. Like, no, that doesn't work that way.
Right. Yeah. Are there certain foods in the diet now that we're getting iodine from, or is it mostly from prenatals and other supplements that you're seeing most people get their iodine?
I mean, iodized salt, of course, has iodine in it. So typically I recommend people switch that out because I did an analysis of the standard American diet, and I would say the average person's probably getting like 1,000 micrograms plus a day.
Okay.
And doses of like 150 to 350 are probably what they need.
Got it.
So just iodized salt is one thing that I would potentially toss. And then eggs and some seafood products have iodine in it, but generally I would say the iodized salt is out.
Gotcha.
And then
so are you saying that I have to stop giving my kids their seaweed snacks, or is it okay to keep the seaweed snacks? What do you think?
Do you have a history of hypothyroidism or Hashimoto's in your family?
No.
Do they have symptoms of Hashimoto's? Are they losing hair?
No, my kids are fine. They're young and they like seaweed snacks. I never really thought about it as being an excess iodine. I always actually thought about it that they weren't getting enough maybe from other sources, but I'm interested in your thought. Yeah.
I mean, I don't give them to my son because he's my son. I have Hashimoto's, right? So, but if you or your wife don't have a history of it, then I would not worry as much about it.
Cool. That's good to know. Thank you for the personal note.
You kind of feed kids what they'll eat, right?
Yeah. I have one daughter that's very picky and she seems to like seaweed snacks. Kids are very intuitive as well on the sense of what their body needs. If I put them in front of sugar and pizza, they're not going to stop until it's done. But
of course,
intuitively otherwise, I tend to feel that they're pretty good at knowing and regulating if you give them that opportunity. So I'm just interested because she's always gravitates towards them, interestingly enough. So, but
I love that. I love that. They did a study of like baby-led weaning of children who were deficient in various things. And there was a nurse letting them pick. I think these were maybe like 1-year-olds or 6 months to like 2-year-olds. And they intuitively went for the foods that contained whatever they were missing.
Yeah, it's beautiful. And you can see that. I'm sure you've seen that a little bit on your side, but I've definitely seen that on mine, just looking at the intuitive nature of what they eat and what they don't eat. Although they call me, like, I always tell them the only place I'll eat pizza is at 2 o'clock in the morning, about 10 minutes from my house where I grew up in New York, because I'm just not going to eat that anymore. But
Yeah, I mean, yeah, you've got your things. Yeah, interestingly, my son loves red meat. We did a test on him and he was like low in carnitine. And I was like, there you go. That's, he and I had incredible burger cravings when I was pregnant. And,
interesting.
I had low ferritin and potentially my son needed more carnitine. I was like,
Yeah.
it makes sense. It makes sense. So it's like when we tune into our bodies, they can really give us that message, right? Of
Yeah.
what we need.
Yeah. I don't think we mentioned carnitine actually. Do you want to go into that a little bit as far as carnitine's role in all this?
Yes, absolutely. So this is another thing that I wasn't aware of on my own healing journey when I first started, but I used to think of it, like I think many practitioners still might, as something you would utilize for a person with hyperthyroidism, right? To prevent that muscle wasting and to regulate the thyroid hormones. And we used to think that it was a thyroid antagonist. But I think that the new research supports that it's a mixed agonist. And so it
A
actually,
mixed.
yes.
Okay.
So,
Can you define what a mixed agonist means? Yeah.
oh my goodness, you're
Yeah.
taking me all the way back to pharmacy school.
I love it. Please.
So essentially it can regulate the receptors. So if you have too much, it will block them. And if you don't have enough, it'll kind of activate them.
Got
right.
it. Okay.
And so that is the thought process of its mechanism of action. And it's been found to be incredibly helpful for people with thyroid fatigue, specifically 2,000 milligrams per day. One of the things I typically see in a percentage of people with hypothyroidism, they might have muscle wasting, they might have brain fog, they might have that awful fatigue, and potentially some excess weight, is giving them some carnitine that can wake up their brain really, really quickly. It's all of a sudden that is going to be a big game changer. And I don't know if it's mitochondrial function that it supports, it's thyroid function. It helps to clear ammonia out of the body when we know people with hypothyroidism might have issues with low stomach acid. So then they're producing more ammonia, and then they might have different kind of microbes that produce ammonia, which of course can be neurotoxic, or that constipation. Needless to say, this has also been a very big game changer for a lot of people. And it's part of my adrenal transformation protocol. That is this 4-week program that doesn't really focus on like pregnenolone and DHEA and all these great things that I used to recommend. It mostly focuses on mitochondrial support and carnitine and adaptogens and really those safety signals. And this gets people like remarkably better within like 3 to 4 weeks.
What kind of carnitine are you typically supplementing? Is it just L-carnitine itself, acetyl L-carnitine, or what do you typically prefer?
I use a mix of both. So acetyl carnitine we know is great for brain function, right? And I feel like that's probably the biggest needle mover for people with brain fog. And then the L-carnitine is great for the body and utilization of fatty acids, and that helps people with preserving muscle strength, as well as a lot of times people with hypothyroidism, they have a little bit of excess weight, so it can help with that.
Okay, interesting. Cool. So I want to talk a little bit about also the things that sort of destroy thyroid function. We talked a little bit about this already, and we can start with the infections, which I didn't know about H. pylori specifically. You mentioned H. pylori is a very common cause or a trigger for something like a Hashimoto's diagnosis or the progression thereof, which I know can take a long time. And I think, as I heard in your particular experience, it was about 10 years before you were actually diagnosed. Maybe if somebody had tested you earlier, you would have seen thyroid antibodies much earlier. I'm sure that would have been the case. But what are some of the infectious toxins, other types of toxins that we're seeing now that are causing this safety issue with the thyroid and making it go wacko?
I grew up on the border of Ukraine. I grew up in Poland. And, Chernobyl, like the radiation.
Right.
This is a really powerful driver of thyroid illness and autoimmunity. There was a super interesting study about the rates of Hashimoto's antibodies in children exposed to Chernobyl, like downwind versus in another part of Belarus. The rates were like remarkably different, where it was something like 10 to 15% and 80%. So this is like a really powerful driver of autoimmune thyroid disease.
So airplane pilots and stewardesses and those that are under more radiation because of being on airplanes, they probably have higher rates too. I don't know if you're aware or no.
Honestly, I think that makes sense because a lot of my clients are actually pilots and stewardesses, and they have a medication. It was called Anadabine, and it was out. Maybe you might be able to get it at like Nootropic Depot or whatnot, but it was developed for pilots and stewardesses. They had higher rates of Hashimoto's compared to the average population.
It's a supplement, yeah.
not on the market anymore, but it actually worked really well to reduce Hashimoto's antibodies and Hashimoto's symptoms. There are also lower rates of Hashimoto's in smokers compared to non-smokers, and quitting smoking can actually be an environmental trigger. They found that the flight attendants and the flight crew on flights that allowed smoking had lower rates of Hashimoto's compared to, flight attendants that were on flights that were smoke-free. So I think there's definitely things that really offset our immune system. And maybe radiation does this, and then smoking does this, and then you put them together and they sort of balance each other out in some strange way, right?
Yeah, nicotine's an interesting one. I didn't realize that had a correlation. We know that certain types of inflammatory bowel disease, for example, if you're a smoker, you have a much lower rate and much less complication. I think it's it's ulcerative colitis, I believe. If you're
and they're reversed, like one gets worse by it, and the other one gets better, and you're like, okay, let's figure out which part of your colon's affected, so we know what to give you, right?
It's a medical board exam. It's a question that you always get on the medical boards, like chronic smoker, comes in with X, whichever one it is, I always forget. But I didn't realize that nicotine was potentially protective in this case. So when people stop, or when they stop smoking, they can actually have symptoms occur at that point. That's been studied, huh?
Yeah, I'll give you my article on Anatobine for the show notes. It hasn't been out for a long time, but I still keep the article, and it used to work really, really well. So we know that radiation can be a big trigger. And a lot of my clients, like I said, are pilots and flight attendants. And I was like, how random is that? And there's actually a connection with that. The other, we talked about iodine, of course. Then there's mold toxins, mycotoxins. I mean, what doesn't mold hurt, right? Like that can be a trigger for many people. H. pylori, I find in people with that acid reflux, they have really high thyroid antibodies, and their symptoms are exacerbated by stress. That is going to be a really big relevant trigger. So I've had some clients with just treating that, they're like, okay, no more Hashimoto's. Not everybody. I wish everybody was like one cause, and then I would be like so happy, because I'd be like a magician with my magic wand, just like boom, boom, boom.
Yeah, they would all just follow a book. It'd be easy, right?
Yeah. But there's usually a few different causes. The other one is the parasite. It's a protozoal parasite called Blastocystis hominis.
Yes.
I started noticing these patterns in 2014 when I was using BioHealth, which is like a lab where they would do old school parasite testing, like under a microscope. Torrance, California. And I would say about 30% of my clients had blasto in their stool tests.
Right.
And then treating that, we would be able to get people, their digestive function improves, their thyroid function improves, their thyroid antibodies drop. A lot of their symptoms would get better. And I was like, this is kind of interesting. And then
how are you treating it, by the way? How are you treating the blasto?
There's a few different ways. Yeah. I used to be very aggressive with Alinea. So I would say like, okay, if you've got this, let's get a prescription.
You are a pharmacist after all. Yeah,
I know. I love my drugs, right? But I would do that with Alinea for like 60 days, because I had read that it's resistant to everything. And it's like, you have it and you're going to be miserable forever. And then that does work. But because it can have metronidazole resistance, I came across other protocols like wormwood, berberine, oil of oregano for 60 days. That seemed to work. Yeah. And then I came across a study done in children that using Saccharomyces boulardii for it was 14 to 30 days helped eliminate it in 80% of cases.
Yeah.
And I was like, so now I just pretty much recommend boulardii for everybody for 60 days. And that's a starting point. And I think that'll take care of it for most people. I have seen people who I've given boulardii to where it doesn't get better. And then that case, I might be like, okay, let's talk to your doctor about some Alinea. Let's get you some of the heavy guns. But for most people, resistance rates might vary depending on the strain that you have. And the testing that I use isn't necessarily differentiating the strains.
Yeah.
But for most people, I feel like boulardii is the way to go.
I've had a lot of experience treating blasto. So it's just interesting to hear yours. I haven't tried Alinea. I've always been successful, usually a combination of berberine and oil of oregano. But then recently, I've just started adding in the boulardii as well. And that's been game changing. So I've been using all three. I don't know. It sounds like you've just with the boulardii by itself, you've had some good experiences.
Even just boulardii by itself. But if you were to get a little bit more aggressive, I think those three are like a perfect combination. They're generally safe. I used to recommend Artemisia, but then I get really nervous about people's liver function. I had one client with elevated liver enzymes, and being a pharmacist, I'm like, no, like I don't like adverse reactions to anything. I think that's a really great protocol that will help most people feel better. Of course, berberine, I have found an oil of oregano for people like inflammatory bowel disease that can be very aggravating. So
Yeah,
you might
sure.
need to be more gentle with that population.
I've certainly had a number of people start olive oregano and just have terrible disaster pants, and we have had to stop it. It can be very, very helpful, but if people can't tolerate it, especially if they have other GI related things going on. But I didn't mean to derail you. I was just interested in blasto. So you were mentioning some of these other toxins, some of these infections. So you mentioned blastocyst being a common one that you saw that you were treating and seeing significant benefit with thyroid antibodies. Were there any others that you wanted to mention?
I think Epstein-Barr virus, people will ask why I didn't talk about that. I think it could be very, very relevant for a lot of people for sure, but it's not clickbait and everybody has Epstein-Barr virus. It's the cause of everything. That's kind of easy to say because everybody has had it.
Right.
Of course, they're going to test positive for it. I have had some people with reactivated Epstein-Barr virus and nothing's getting better. They tried herbal things and they tried working with their prescriptions. And then strangely, they've had blasto. And I think there's like this, again, some sort of teeter-totter with like how microbes interact. And I know that blasto can deplete us of, was it lysine? And then arginine can help fight it. So I don't know if it just sets some weird amino acid cascade off, or have no idea what's going on. But long story short, we treated the blasto and it's like Epstein-Barr virus is no longer expressing itself, or they had mold exposure or something like that. And then you treat that and then the Epstein-Barr virus gets better, or like they have methylation issues. And so you give them methylfolate. So I'll do that. And I like lomatium for it. But honestly, I wish it was like, oh, everybody has this. Everybody should just take antivirals for it. It hasn't been that straightforward for me. There's things I think in the literature, take SIBO, for example, as a cause of IBS. Like people will talk about that's the cause. But then when you actually work with real people, you're like, I was sure this was the cause, but you don't have this. What am I going to do now? Right.
Yeah. Yeah. I feel like 100% in line here with you, because when I think about EBV reactivation or EBV by itself, typically, unless they're very young and have an initial acute exposure, even a lot of things like Lyme disease and mold for many people have been ongoing for many, many years. And all of a sudden they have some sort of threshold event where their immune system just goes haywire. And this happened a lot during COVID, as I'm sure you saw in your own experience, and especially and as myself included in my practice as well. And I found that people were going after these kinds of things, like the EBVs of the world, the HHV6s of the world, and other kinds of even Lyme and mold, which you may have to address. But if you're not addressing that sort of base immune system function aspect of things, you're not going to get them better on those other aspects. It's been my experience too.
Yeah, it's kind of interesting because I'm not like a Lyme literate practitioner. I'm very intimidated by Lyme. And I used to be like very intimidated by mold. And I used to be intimidated by inflammatory bowel. I used to be intimidated by eczema, but I knew thyroid and Hashimoto's really well. And then I'll like come across a topic and I'll be like, oh, this is so scary. And then I'll be like, wait, a lot of the things I used for thyroid work. Holy cow, like that. And sometimes it's simpler than we think it is. I still don't. If somebody came to me with Lyme, I'd be like, let me take you to my friend across the way because I'm not comfortable with it. But it's amazing how sometimes some of these same patterns show up that could really offset the immune system, right?
Right. And that's why I think it's so important to have a foundational approach, no matter what is going on. And I was mentioning to you before we started, we have a nonprofit that sponsors the podcast that it's called Health Optimization Medicine in Practice. And the idea is that root cause medicine is very real. It's very needed. But if you're just focused on a symptom or a disease, sometimes you can miss the larger picture. And as you know, your protocols for Hashimoto's oftentimes will work for people with Lyme or people with mold exposure or people with other viral reactivations. And so that means that there is these foundational things that all of us can really benefit from. And as clinicians, it's great for us to be able to look at things, not always with the disease lens and looking at it again, just from a foundational perspective. And so I appreciate that perspective too.
As far as toxins, fluoride can be another toxin. The excess can cause hypothyroidism. It used to be, I believe, to treat hyperthyroidism before meds for it were available. And to your point about the foundational things, one of the things that made my Hashimoto's protocol very popular, and this was pure accident, just me having a client. Like when I first started working with clients, I was like, ooh, let's do all of these tests on you. This is going to be fun. And I'm going to review this test and this test. And it's like $1,000 later and they're still having symptoms. And I'm like, try this B vitamin. And they're like, I can't, it gives me palpitations or everything. You know, I'm like, go gluten free. And they're like, I don't feel any different. And then I started giving people liver support, just like a few different supplements for liver support. And I had all these people with like multiple chemical sensitivities, people who weren't able to tolerate supplements, people who weren't getting better with anything, just get better within 2 weeks. And I was like, huh. And it's kind of like, you know, that root cause approach. I would be like, let's run 75 different tests on you and see which exact toxins you have. And then I will find something very specific to move that toxin.
Right.
Where I didn't have to do any of that.
Right.
I would still do the test, but then I'd be like, here, do this for 2 weeks. Go to the sauna, make sure you're sweating. Don't heat up your food and don't put your spaghetti in plastic, right, in the microwave. Right. And do some of these like low-hanging fruit. Get a fluoride filter. Don't do excess iodine, so on and so forth. And get some liver reset on board, some amino acids, some things that support phase 2 elimination, get some NAC, liver gallbladder support, magnesium, and they would get better. And then I wouldn't have to be like, here are your test results 6 weeks later and you are elevated in this, right? I don't even know, like a lot of the toxicity tests, I don't necessarily do as much because I don't know how accurate they are. Right. And the other thing that I just learned, so I'm pretty well versed in mold these days as of a few years ago, but I didn't know this when I developed the protocols, is a lot of that liver support actually moves mold mycotoxins out of the body too. Sure. And I was like, oh, somehow these people had mold. It wasn't even on my radar, but I was helping them move it out of their bodies, right?
Yeah. When it comes to liver support, did you have a particular supplement that you would use, or was it like a battery of things that you just described? Like, I know there's a number of companies that have various types of liver support, liver cleanses. I just don't know if you have any particular favorites that seem to work best.
Yeah. So I would use like a methylation support supplement, either from Designs for Health or from Pure Encapsulations. A lot of different companies make them. I actually make them now with Rootcology, and it's just called methylation support. So it's B vitamins and trimethylglycine. So your folate, your B2, your B6, B12 to support that methylation pathway, and obviously methylfolate. And then I would use N-acetylcysteine, and then I would use like something like ox bile with liver supporting nutrients. So anything that can thin the bile, that would be helpful, like dandelion, beetroot powder. And then I would focus on doing like a magnesium citrate, because I used to use binders, but then everybody got constipated. Or not everybody, some people did. And you want them eliminating when they're binding up their toxins. So you want them pooping. And then I would do like a liver powder. So there's various companies, like Cymogen makes one. I make one with Rootcology. Designs for Health makes one. Orthomolecular. Every company has their own thing. And it's usually like milk thistle and N-acetylcysteine, a whole bunch of amino acids. And then like a solid amino acid supplement that contains calcium deglutarate and a bunch of different amino acids that help with that phase 2 liver transformation to move all the toxins out. And it's like, oh, I didn't even know that I was working on mold toxicity or this kind of toxicity. And I kind of learn about it as time goes on.
Yeah, the back way. I like that, because this is the way I think about things too. You could test for every single toxicity, but if you already have indications that they're under a huge oxidative load, if they have signs of oxidative stress, if they're vitamin, mineral, and nutrient deficient, and they have a clinical picture that is showing you that they're under stress, very likely they're going to need this kind of support, whether I'm testing for glyphosate levels or even mold on some levels as well. Now, not to say that certain times don't require you to get the treatment for mold, of course. And of course, also for Lyme disease, I have a lot of Lyme literate friends that do a lot of great work in this world, and they're doing active treatment for Lyme as well. I've talked to a couple of these people, my friends, for a long time. It's like they've gone away from treating the active Lyme initially as much as well, and working on some of the things that you're just describing, right? And working on the inflammatory responses, working on the detoxification pathways. Because, I mean, I grew up in New York. Most of us that grew up on the East Coast were exposed to Lyme at some point or the other. And in the South, exposed to mold someplace or the other, because it's wet, it's humid. In Colorado, only your husband can come here because of his genetic thing, but the rest of it is not very moldy here typically. Although Jill Carnahan, a practitioner up here, will talk about her stories with mold and because of severe floods. So anyway, just to say that I'm with you. I think that working on these foundational measures is in the interruption. This episode is brought to you by Health Optimization Medicine and Practice Association, a nonprofit organization training practitioners how to optimize health rather than treat disease. Check out the Exposomic module. This is the module where we talk about toxins in our environment, many of which are affecting our thyroid function. We talk about fluoride, for example, in this podcast and talk about how that affects thyroid function and more. Go to homehope.org and use code podcast10 to save 10% on this module or any module of the Essential Certification course. Now back to the show. One other one that I want to talk about before I switch a little bit is gluten itself, just because I know gluten has a significant capacity to have cross-reactivity. I know that you've had experiences with this personally, but what is the science behind this overall when it comes to gluten sensitivity, allergy, and how this kind of plays into thyroid disorders overall?
So there's a few different schools of thought as far as, is it American gluten? Is it gluten here? Is it gluten there? Now we know that there's some cross-reactive proteins on the gluten molecule to the thyroid gland. Initially, I came across this with a study done in people with celiac disease who also had subclinical hypothyroidism and Hashimoto's. When they got on a gluten-free diet, a percentage of them were able to normalize their thyroid function, right? And so there's definitely this autoimmune cross-reactivity happening there where you eat this stuff and your body thinks it needs to be attacked. So then it attacks everything that looks like it. And we've got the molecular mimicry type of mechanism of action. And I think definitely for celiac disease, people are like, yes, if you have celiac disease, you should be gluten-free. But it's a little bit harder for people to believe that might be the case with Hashimoto's, where I have found about 88% of people that I've worked with and that I have surveyed with Hashimoto's, they do feel better gluten-free. And sometimes they feel even better gluten-free than like I'm taking Armour. They'll say it gives them more energy and less brain fog and less pain in their bodies. So I feel like it's been over 3,000. My survey was like 2,232 people. And then with client outcomes, it's been about 800 that I've had them do the outcome survey. So like 3,000 plus people feel better gluten-free when they have Hashimoto's, or 80. I can't do the math so fast in my head right now. I need some Methylene Blue. But
that's cool. Yeah, that's my next topic.
88% of them feel better, with going gluten-free. And I think that's super, super relevant. Different schools of thought are like, oh, it's American gluten because it's been sprayed and it's got glyphosate and it's just different. You know what? I lived in Europe and I have clients in Europe. Guess what? People in Europe that have Hashimoto's also feel better gluten-free. So I like that theory and I wish it were the case. And that's not necessarily always the case. Some people do have a bit of a honeymoon period where they will they're American, they go to Europe, and 2 weeks off on gluten, European gluten will be just fine.
Yeah.
But I think the proteins are slightly different, so it takes a while for the immune system to catch up. That's been sort of my observation with that.
So it's like an immune reactivity because the protein is slightly different. They don't have the reactivity that they would have, but if they stayed there long enough kind of deal, hypothetical, or maybe it would actually start having an issue.
I mean, I have clients in Poland, and Poland doesn't use GMOs, and other countries in Europe don't use GMOs, and they still do better on a gluten-free diet. Germany, Amsterdam, like all over Europe. I can't say clients in Asia. Like I can't say I've had clients in every single country in the world, but definitely a lot of European clients, right? Yeah. And they do better gluten-free if they have Hashimoto's. Then there's a theory that wheat is a FODMAP, right? And so if you have SIBO, then that could be causing you to have a reaction. About 50% of people with hypothyroidism have SIBO. So it could be that component. Then there's the thought process that wheat is a high nickel food. And so that might be actually nickel sensitivity. That is the reason why you're reacting to wheat. Then there's like the IgG antibodies. So there's so many different theories, and you could really go down the rabbit hole of why, where I'm just like, I don't know why, but like just get off of the gluten and see what happens. Let me know how you feel, right?
Yeah.
Like back in the day, I was like, oh, maybe you have celiac and you should test for that. And then maybe you should get off gluten. Now I'm just kind of like, just do it. I've seen it so many times, right?
Yeah. We know that all the testing out there for food sensitivity, for example, is not very good. Most of it's not very good, or it's not very reliable, and especially, at least in my experience, not very, very reliable for wheat or for gluten or itself, if you're looking at IgG specifically, right? And then, as you said, it may not be IgG that might be the issue. So what I always tell my patients is that even if you don't come up positive on a sensitivity panel, whatever it might be, that at least we want to give you a 3-month trial of being completely off of gluten to how you feel. Is that something similar to what you would do, or do you have a different approach?
I mean, if they have Hashimoto's, then it's pretty much gluten, dairy, soy-free for at least 3 months. And sometimes there are more foods that need to be eliminated. And most of the foods can be introduced back, but gluten, I have found a way to resolve egg sensitivity and various food sensitivities. That's kind of my side project that I enjoy, figuring out like the metabolic pathways of how different foods are broken down and what components could be causing issues.
Oh, that sounds fun. Okay.
I haven't figured it all out, so I don't know about gluten. Right now, for me, it's like if you have Hashimoto's, you should be off of it long-term, lifelong. I used to think that about dairy, but I have found dairy protocols that seem to resolve dairy sensitivity. And then as far as testing, I have found the Allotest food sensitivity test, IgG. I have found that to be highly accurate. I recently did like a comparison just on myself with another test. And I was like, which diet should I follow? I ended up feeling like the Allotest was still more accurate. I've done this test for 12, 13 years with various clients, and it'll be like spot on, where they'll have a random food reaction like pineapple. And it's like, oh, it was the pineapple or it was the ginger that was causing your acid reflux. So that's
even for gluten as well, or is it something that you, even if there's not so much, you would be relying on the test for that?
I've done like a preliminary analysis of the food test sensitivity results. I've done, I don't even know how many at this point with people with Hashimoto's, and majority of them do show up sensitive for gluten, like 80 to 90%. Now that I think about it, it's like all these piles of projects that I
love it.
started.
I have all these rabbit holes that I want to take you on, especially your dairy sensitivity decreasing, or however you want to talk about it. My wife's an allergist, and they'll talk about desensitization and how that works. But I don't know if you want to give us a quick overview of how you do that. I don't want to take too much of your time on it, but it sounds interesting.
The first one that I kind of realized was egg sensitivity, and people who have like skin rashes and just like cystic acne and all of these things. I would kind of look at them and they would have all of these rashes. And I realized it was like a sulfur thing. And then I remember Biotics research. I happened to go to one of their trainings or whatnot, and they talked about utilizing molybdenum through the SUOX pathway to help with breaking down sulfur properly. And this is like a cofactor that could be missing for some people. I think Doctors Data did some hair analysis of people who were sulfur sensitive or had sulfur issues, and they had low levels of molybdenum. So using molybdenum can be very helpful with that, as well as lysine and then butyrate and B12 to kind of bind up sulfur in the body. So I have helped people with, I won't say anaphylactic reactions, but just those food sensitivity reactions to eggs, broccoli, like they can't take NAC, they can't take things of that nature.
The sulfur ones, yep.
Yeah, like sulfur containing supplements, or selenium was probably one of the things that got me down the rabbit hole with it. But that has worked for a lot of people. And it's usually a few weeks of following this where you normalize their ability to like metabolize sulfur, and it's in that little cofactor. Another thing was salicylate toxicity. So, with the allergies and the asthma and eczema and skin issues, so to properly clear salicylates from the bodies, we can use glycine. And so for some people, just using glycine can help them normalize their salicylate levels. You can do an organic acid test to see if they're elevated. And that we've had people get rid of asthma. I mean, I don't know if it was official asthma, but they were diagnosed with it, and allergies and all of these other weird reactions with that sulfur, with that glycine breakdown. With dairy, it was completely random for me, but it was using carnitine and alfalfa. And these were breastfeeding supplements, right?
Yeah.
And I was like, I used to be very, very dairy sensitive and disgusted at the sight of dairy once I got off of it. And all of a sudden I was like, why does dairy smell so good to me? And I was using these while breastfeeding to get my milk supply better. And
Sure.
interesting, alfalfa is a preferred food by like ruminants, and it helps them like produce more milk and all these other things. I think it might be the potassium content. I'm not quite sure. And then carnitine, of course, helps with settling fatty acids. But I've had with myself, it was carnitine and alfalfa, some digestive enzyme support. And I've had a few people utilizing that. I will say alfalfa, if you're a woman that's recently stopped breastfeeding, it might not be optimal for you because it can drive, if you don't want more breast milk, that might be a problem.
Sure.
Therefore, a lot of people with lupus may not do well with that.
Okay.
But I've had a handful of clients where they don't have dairy sensitivity anymore with that protocol too.
Wow.
So yeah, it was kind of hard to narrow it down because I was like, I'm taking 10 different supplements, which of
Sure.
but it ended up being those 3. So it's taken a few years to
Yeah.
guinea pig it on different people.
I love your rabbit holes, Isabella, because you figure out like one little thing and then you can take like the pharmacology tack and say, well, what is actually happening here pharmacologically? And then taking that and then creating this pathway to figuring out, oh, this is how it's actually working, right? And that's an unusual skill set and very, very cool. And speaking about pharmacology, our last topic I wanted to kind of chat about is Methylene Blue. I know this is how we first met, and you first reached out because my company, the Transcriptions company, was making this. We still do now, of course. And I'd love to hear a little bit about your experience and how you heard about it and how this has kind of become part of your regiment, if you don't mind.
So, I reached out to you because I just finished writing my last book on irritable bowel syndrome, and it's really been a project in the making for 10 years. And
Sure.
I reached out to you because I was like, I feel like I need to put you in my acknowledgments for helping me finish the manuscript. Whenever you're an author, you write your acknowledgments. It's all the people that helped you make this book possible. And like you and Methylene Blue are definitely in there. I think it has helped me tremendously with focus. And I love rabbit holes, but sometimes going down rabbit holes isn't so great when you have deadlines.
Sure.
And so it's really helped me focus on getting my manuscript done. And really, I feel like it just is amazing for your brain function and just having a bit of clarity. So I would say I'm the kind of person, I think a lot of entrepreneurs or healthcare professionals and creatives can relate, where you have 1,000 different ideas at once, right? And you have 1,000 different projects and everything is fun and exciting. And that's sort of my personality. But sometimes it would be like I'd have 10 things that I started at once. And then I was like, okay, how do I like go back and finish this? And that's something that's been a game changer for me in helping me finish various, obviously my work projects, but also just projects around the house where if I need to focus, I'll take one and then I feel significantly better with my ability to focus. And the way that I do it, and perhaps you can explain the science, I'm sure much better than I can, but I'll typically take a Methylene Blue and then I'll do some red light therapy and then I'll drink a matcha tea right after. And the matcha tea, for anybody struggling with blue teeth and tongues, that just washes it right out. So you can like go and have a Zoom call or pick up your kids from school without like looking like you just made out with a Smurf. And you told me recently that you can swallow Methylene Blue, which is amazing. But yeah, this is something that just really helps me get in the zone and really helps to wake me up. And I know that there's some synergy between red light therapy and Methylene Blue too, right?
Yeah, there is. It's working on the same complex. So complex 4 is where red light or near infrared light works, around 680 nanometers. And along with Methylene Blue, donating electrons to the same complex. The cool thing about Methylene Blue is it actually can donate electrons to any complex that's required. But under normal conditions, when mitochondria are working well, it's typically going to donate to complex 4 itself. And so what is your dose typically of Methylene Blue that you would take, Isabella, when you would take this combination? Can we call it the Wentz protocol? You already have a lot of those, right? We can talk about
Methylene there we
Blue,
go.
Red light, matcha.
1/4 of the higher dose one of
the Tro Plus. Yeah.
Yes.
So we have the Tro Plus line. The Tro Plus Blue is our first professional only product. This is our higher strength Methylene Blue tablets or troches that are 50 milligrams. So you're taking 12.5 milligrams then.
Correct. Yes. And now my husband is writing a book. So he's been trying to finish his book. And when we last spoke, he had a respiratory infection and we gave him a little bit of Methylene Blue. So he's using it now too, and it's helping him write his book too.
You guys are co-authors in the same house.
Yeah, our son recently wrote a book too.
He did.
Oh, I mean, he gave me the idea for it, so he kind of narrated it, and then I kind of wrote it up. I interviewed him for it, so it's we have a lot of fun. He isn't quite taking methylene blue yet, but he was eating a blue lollipop the other day, and he goes,
"Yeah,
Mommy, look, I'm taking methylene blue." We're a special family. Yeah.
All right, well, that's beautiful. In my house, it's usually frozen blueberries. That's the closest there that the kids will get the blue mouth. We have, yeah, I always tell them that when they're older, they can take methylene blue. But, we do have practitioners that are using methylene blue in younger kids and significant benefit overall because of the mitochondrial function piece. And also that not only does it help make energy, but also it works like an antioxidant at the same time. When you take it, do you feel more energy, just it's more kind of clean focus, or do you feel like a lift, or do you feel like your exercise is better? Do you have anything in those capacities to think about?
I haven't tried exercising. I usually do focused work with it.
Sure.
And I am one of the, how people need exercise for mental health? I don't. So, like, I'm not somebody that's like super, like, yes, but it really helps me with my focus and that ability to actually sit down and do what I need to do. Like as a entrepreneur, healthcare professional, I like author, I run 2 businesses.
Right.
I could get all over the place and a mom, I have to do so many different things. And it really helps me just zero in and focus. I would say my energy is lifted, but it's not the same as caffeine.
Right.
So it's not like edgy, irritable energy. It's just kind of like very clear energy. And that amazing focus is like, I have my 100 ideas, and all of my ideas, like just like 99 of them sit down and one of them stands up. And then I could just really have a conversation with that one idea. And it's amazing because you just like you can do one thing at a time. And it's been a really big game changer for me. And the other random thing, and I don't know if you've seen this before, but my nails have grown so much since I started using it. I go to like mani-pedis every few weeks.
Sure.
My manicurist is like, wow, you've got like the most beautiful nails. And they like cry when I want to cut them. They're like, are you sure you want to cut them? I'm like, yeah, they're just going to grow back so fast. And they're like, what do you do? And then I saw another person posting that it helped them grow their nails. And then it clicked to me. I was like, oh my gosh, this has been a game changer for my nails. Some people's hearts are very, like, if it'll make my hair, skin, or nails better, I'm all in. So if you're listening, if you're one of those people, like, that this is your tool. Like, not only will it make you smarter, but it can give you beautiful nails.
I wonder, and I don't know if you've tested do you have any antibody levels at all at this point related to the Hashimoto's?
I do, yeah.
Yeah. I wonder is there a way we can actually measure antibody levels over time in somebody taking methylene blue to see if it has an impact in decreasing those? I know one of the reasons why hair and nails can be a problem in Hashimoto's is because you have thyroid dysfunction to some degree, or you have the inflammatory aspects of having an autoimmune, condition.
I think that's a really interesting idea to see if that helps with the thyroid antibodies. I know personally for me recently, it was a gut infection. So I looked very pregnant for a while, but I was not. I just treated that a few months ago. And then I don't look pregnant anymore, which is amazing. But I know that was a part of what was driving my system. So I was also taking methylene blue. So I tested before and after starting, but it didn't have an impact. Gotcha. So I feel like I would want to isolate it just to make sure.
I don't know.
That was like a new thing that I have this amazing prosciutto. So good. And then after I got home, I was like, something's not right. And then with a few months later, I ended up with like, my friends were like, you have some news? And I'm like,
no,
I don't have any news. And all of my like yoga pants were getting super tight. And I ended up utilizing gut testing as I was writing my gut book. I'm like, what's wrong with my gut? And sure enough, I had a lovely protozoal infection.
Maybe at some point when there's no other variables, we can test it again with you and see how things go. But it's funny how that works when you're writing a book on something or you're studying it, and then all of a sudden it becomes like real life in some ways.
This infection I had, I was like, I thought it was pretty benign, but apparently like going down the rabbit hole, it's like, oh yeah, it can cause inflammation. And sure enough, it was like sweatpants being too tight. And I'm built like a greyhound. And so it was really weird because it was just like my belly.
Yeah, I gotcha. Yeah. I have a funny story when I was in medical school and we were learning about the jaw in anatomy class. And I ended up getting punched in the face randomly on the street,
Oh,
right
no.
in my jaw.
How is
And I was
that?
like, well, I
What
was
kind
like,
of places were you in?
I was in Baltimore. Right? Anything's possible in Baltimore. But so
Okay.
I trained at the University of Maryland. So, Isabel, this has been great. I really appreciate you spending so much time with me to chat. I have one final question for you, and it's a question we ask everybody at the end of the podcast. And it's, what are 3 ways that anybody listening can live smarter, not harder, as it is the name of our podcast? And the idea with our company is to try to find ways to help people right now, the Transcriptions Company, right now along that path to optimizing their health with energy focus and things like that. We have the nonprofit that's also helping over the long term. But what are your thoughts out of all your experience, clinically or otherwise, as a mom, as a wife, whatever you think might be relevant?
I mean, honestly, one of the things that can be very, very helpful for most people is spending time in nature and then
Mm-hmm.
really getting tuned into the circadian rhythm. So that bright light exposure in the morning, that's such a big game changer for your energy levels, and avoiding the bright lights in the evenings. This is going to help you sleep so much better. And sometimes just circadian rhythm alignment can help symptoms like the fatigue and the brain fog. And just doing that can be such a big needle mover for people. I would say most people would benefit from some sort of a cleanse or reset every 2 weeks out of the year, where you go through and you do some sauna sessions. I would say 30 minutes a day for 4 times a week for those 2 weeks, and
Mm.
some liver supporting nutrients. That can be a really big game changer for people. And then really figuring out what kind of foods are very nourishing for you. That can be a big driver, because then getting into the habit of just eating things that are really good for you and getting into those habits can be a big game changer. And sometimes I do utilize the food sensitivity testing, or sometimes there's genetic testing people can do to see what foods they do best with. Because sometimes it's like, oh, carnivore is good or vegan diet's good. And it's like, at the end of the day, we're all kind of individuals and we have to tailor things to ourselves, because that can really help you from going against the grain.
It's beautiful. And which was the allergy test that you recommended? The food sensitivity? Was it ALA? Is that right?
ALLETESS, ALLETESS.
Many more letters to that I thought when you first said it. So awesome. Thank you for that. And so where can people find more about you, Isabel?
My website is thyroidpharmacist.com. I have books on Amazon and everywhere fine books are sold. Hashimoto's Protocol is one of my most popular books, 90-Day Plan to Reverse Hashimoto's Symptoms. And then Adrenal Transformation Protocol is like a 4-week plan. That's my latest book that really focuses on like the fatigue, brain fog, anxiety, insomnia, sleep issues, pain, and just kind of rebalancing the nervous system. And I am on Instagram and Facebook. You could find me under Izabella Wentz PharmD or Thyroid Pharmacist.
Well, thank you so much for spending a lot of time with me. This is actually my longest interview on this podcast.
My goodness.
And I didn't want to stop because I have so many questions, but this has been great. So I hope to see you sometime soon in person, but thank you for all your support, with Methylene Blue as well. I'm glad it's helping you. And I look forward to the next time we get to chat.
Thank you so much for creating these wonderful products. I really appreciate the work that you're doing in the world, and thank you for having me.
Thanks so much for tuning in to another episode of the Smarter Not Harder podcast, where we give you 1-cent solutions to $64,000 questions. This episode was such a fun one to record. Isabella is a wealth of information. I really hope you got something out of this. I definitely did, many times over. Her curiosity, her rabbit holes, her work is just amazing. And if you like this podcast, please don't forget to like and subscribe below. Share with your friends and colleagues. We hope to see you next time. Have a great day.